Well, it's true, as you talk about the decisions we make toward the end of life, that God will take us when God decides to do that. But on the other hand, God has given us minds and hearts in order to enable us to understand God's will as we possibly can. So I think when we face terminal illness, God gives us the abilities to think about, well, when is enough? What is the point at which I should say, I don't want any more treatment? And if you look at it from a positive perspective, it can also be a way in which the patient says, okay, it's time for me now to prepare for my death, which I think is exactly what the Ars Moriendi literature many centuries did, that it helped the patient prepare for dying and to think about what this meant from a spiritual perspective. Patients always have the right to make decisions about their own health care. And even if they're decisions that I might not make, a patient can always say, this is enough for me. And I think we need to help them do that. Some people think that there's a book out there that's got a list of ordinary means on one hand and extraordinary on the other. But what that really means is that we make a decision about whether a treatment is ordinary or morally obligatory, in other words, something we should undergo, on the basis of a calculation of burdens and benefits. And you look at the treatment, you look at the possible benefit that you might get from it, you look at the possible burdens of it, which include pain, which include cost, inconvenience, and you balance it out. And patients have to make that decision themselves. It's always from the patient's perspective. Sometimes others have to make it for you, but even then, it has to be from your perspective rather than anybody else's. It's a highly subjective calculation, and it changes. Somebody at my age and in relatively good health may make that benefit of burdens and benefits that calculation of burdens and benefits differently than I would if I were 20 years older and had multiple chronic illnesses. So that calculation can change as well. But it's the fundamental discernment that we go through as we face serious illness. Yeah, it's always interesting to ask, how do I know if it's okay to forego this treatment or to withdraw it once it's been started? And I think those decisions, at least for us as Christians, have to be made in light of our faith and belief in the resurrection. That God created us to live beautiful lives and to have friends and marriages and children and good careers and all of those things. But ultimately, God created us in order to be with Him in eternal life. And so when we face serious healthcare decisions, we have to trust that God is going to give us the good judgment to know when it's time to begin that journey back to God. And I think we should do that out of confidence and hope rather than out of fear and anxiety. We often ask the question about whether there's a purpose or a reason to suffering. And that's about as basic a theological question as you can get. Does God want us to suffer? Do we need to suffer in order to be saved? And I don't think we would go that far, but I think we would say as Christians that there's a redemptive value to suffering. We don't look for it, we don't seek it, but sometimes suffering comes into our life, and it is an opportunity spiritually for us to look at uniting our lives with Christ, as Christians would say. So I think when we're dealing with serious illness, we clearly want to reduce pain and suffering as much as possible, and we can do a lot of that. There's often fears, well, am I going to suffer needlessly? We're pretty good at pain control, pain management right now. Although there are still physicians out there who are hesitant about it. Maybe they're afraid they're going to make the patient addicted, which I don't really think is an issue in end-of-life care. But so while we don't look for suffering, we don't seek it out, I think there is a purposeful way in that we go through suffering as this process of entering into eternal life. It's going to be so different from what we exist now or what we live now that we could say, well, all right, this is part of my transition into the life of God. And it's not a totally bad thing.